you, Senator Ketter. Senator Brown.
Thank you, Acting Madam Deputy President. I rise to speak about Arthritis Awareness Week, which started on Sunday. The theme of Arthritis Week is Kids Get Arthritis Too. Most people think that arthritis is a condition that only affects older people, but kids' arthritis is as common as childhood diabetes. Juvenile idiopathic arthritis, also known as JIA, is a painful autoimmune form of arthritis that affects around 6,000 Australian children. These children often face long delays in diagnosis, and there is a serious shortage of treatment and support services available to them. Often the pains these children suffer are dismissed as growing pains. Yesterday I was privileged to listen to a panel led by the 2013 Australian of the Year and Emeritus Director of Arthritis Australia, Ita Buttrose, AO, OBE, at a special Parliamentary Friends of Arthritis function where children and families living with juvenile arthritis shared their stories. Their stories of constant pain and suffering was a real eye-opener. Ben Hogan was diagnosed at 2 years of age. That was 42 years ago. When he was 4 years old, doctors told his mother he would not live past 10. But despite spending many years in a wheelchair, Ben has proved the doctors wrong. He is married, he has 2 children and a job in the health sector that he loves, and he gave a wonderfully insightful and determined story of his journey. 21-year-old Annie Grinwood was diagnosed when she was 8 years old, and in her own words, she went from being a happy, active and normal child to a very sick little girl, spending weeks in hospital and 3 years in a wheelchair. Annie says she missed 70% of school and was hard making friends. Adolescence was tough as she dealt with depression from the chronic pain and loss of mobility. Bright-eyed 6-year-old Rowan Milne was diagnosed with juvenile arthritis when he was 2 years old. His father, Scott, said his son had been unwell and in pain since he was born. He would wake up screaming 6 times a night and had fevers and rash. When Rowan's parents took him to the doctor, they were told he had a virus, but they persevered, and after many, many months they were told it was JIA and his immune system was attacking his joints. Ronan takes pain medication every day, chemotherapy drug once a week and has injections every 4 days. His mother, Belinda, says the medication can make him tired and irritable, and having juvenile arthritis has already had an impact on his schoolwork and also his participation in sport. Arthritis Australia says these stories are all too common ones. The National Policy Manager of Arthritis Australia, Franklin Marine, said, and I quote, "We know that the sooner JIA is diagnosed and treated, the better, but our research has shown that many children with JIA have their symptoms as a long time before they are diagnosed, and during that time the joints can be seriously damaged." To raise awareness of this painful and disabling condition, Arthritis Australia have released a 5-point plan to address what they believe needs to be done about childhood arthritis. Arthritis Australia is seeking funding for paediatric rheumatology training in Australia, public paediatric rheumatology service to be expanded, JIA information and educational materials for healthcare professionals to be developed, comprehensive JIA consumer resources to be developed, and funding for research into a cure. One of Australia's very small band of paediatric rheumatologists, Associate Professor Devendra Singh Grewal of the University of Sydney, has welcomed the 5-point plan. If it is implemented, it will make a big difference in treating kids with arthritis. Professor Singh Grewal says JIA can look quite different from child to child, and it can be hard for GPs to detect it early, and even when it is detected, it can be hard to get in to see a specialist to start treatment. He says that most states only have 1 or 2 paediatric rheumatologists, and in some states there are even none at all, such as in my home state of Tasmania and also the Northern Territory. The professor says it's tragic that children wait so long to be seen by a specialist because there are effective treatments for JIA, and the sooner the treatment is started, the more likely it is that the condition can be controlled and severe joint damage can be avoided. Research is vitally important to help develop better treatments and hopefully one day to find a cure for juvenile arthritis, which has also been described as an invisible condition. While it may seem an invisible condition, it is all too visible for kids with arthritis and their families. We must do all we can to ease their burden. Thank you.